Well, we are here at Blue Cross Blue Shield, but not really. Dr. Ann Schmidt, medical director at Blue Cross Blue Shield, is at a remote location, as I am at a remote location. And because of COVID, we've decided to. There's so much important stuff that Blue Cross has to offer. And today, we're going to talk to Dr. Schmidt about the heat and how it affects the elderly. And it also affects everybody, right, Dr. Schmidt?
Oh, absolutely. And thank you so much for having me remotely. I think COVID has made all of us a little bit more able to adapt and do things remotely that we never thought
Sure.
we'd be able to do. So thank you so much. And absolutely, this time of year, even late summer in Alabama, it still remains incredibly hot on some days. And so, even in the time with COVID and with other illnesses, it's still important to remember kind of the basics, I guess I would say, which would be heat related illness. We know that people who are over the age of 65, especially, but anybody as we get older, we're more susceptible to heat related illness. That could be because we're taking medications that impact our ability to regulate heat. It could just be because as we get older, we don't respond as quickly to changes in heat. And so it's really important, especially for seniors, to be aware of any changes that they're seeing. As always, prevention is the best cure. So if you can avoid being outside during the hottest times of the day, if you have to be outside, take breaks, drink plenty of water, stay in the shade. If you're taking medications and you have to restrict your water intake, be sure you talk with your doctor about how much you can drink when you're outside in the summer. Sometimes we might not think about those differences, as physicians. And so be sure to talk with your physician if you're outside in the heat and you need to be, drinking more water.
Yeah,
And be, go ahead.
excuse me, I hate to interrupt you, but I always do, as you know, Dr. Schmidt. Um, what about the fact that, you read these articles that you should try to get 20 minutes of sun if you can to get that vitamin D, if you're not taking D3 or vitamin D, 20 minutes of sun. Is that really necessary? I don't know, 3 days a week, 4 days a week, whether it's in your backyard or art gardening or what? What's the situation with that?
Well, vitamin D obviously is very important. And that's one of the vitamins that our bodies can actually manufacture, as you've said, with sun exposure. I think it's very important though to you can get your sun exposure in the shade also. So you don't have to be in direct sunlight in order to
Oh,
get exposure to the sun. So being in the shade is a great option if you have a nice cool place to do that. But if not, as you mentioned, if you have a low vitamin D, supplements are certainly a way to do that. We always want to practice safety first.
so how do we get the sun in the shade? I'm a little bit confused.
Sure. Well, the sun's right, the UV light that we talk about that our body uses
Oh,
to convert that comes through the shade. It comes, through water. I think that sometimes even in the shade, people might not realize that they're getting dehydrated or they're getting overheated, because we feel cooler in the shade. We don't feel like we're in the sun and that we're getting that exposure, but really we are. Our bodies can still use that.
we see so many people walking these days, especially now. Uh, you see in our neighborhood, my goodness, you see more people walking than ever before. So what is the proper cover up, long sleeve shirt, sweatpants, a hat? What's the proper cover up?
That's a great question. So we go back to heat related illness, but then we also want to take into account protection, from the sun's rays when we think about skin cancer prevention. So I
Yeah.
think it's just really important for every individual to pay attention to how you're feeling. If you want to take a walk, try to do it early in the day. Try to do it, at 5:30 or 6 in the morning. That's really early, but it's probably the safest time this time of year. Or in the evening, if you have a safe place to walk, with sidewalks and with lighting. We want to be careful, in dusk, not to trip, not to, be in a way of cars or bicycles or other people who might not see you. But certainly, if you can walk earlier in the day or later in the day, that's the safest time. You can wear long sleeves, certainly, but just pay attention to how you're feeling. If you start to get overheated, if you start to sweat a lot, and if you feel your heart race, those are really signs that you need to stop, sit in the shade, put some cool towels on your face or your neck, and definitely get inside as soon as possible.
Yeah, so I guess a good idea is to carry a little fanny pack with a wet, cool towel in it, and most of the time they stay cool, would be a good idea.
That's a really good idea. And some water.
And some water, absolutely. So is a lot of this information on the website at Blue Cross Blue Shield?
We provide the information on our website, alabamablue.com. We'll get that posted out there because it's important not just for seniors, but for everybody this time of year. Again, Alabama, we've got the hot weather and we've got it for a long time. So definitely important points to remember.
Well, I want to thank you so much for being with us today. And we look forward to seeing you again in the next couple of months because we're going to do several of these, I guess, tele interviews. So thanks a lot, Dr. Schmidt. We'll see you soon.
Thanks for having me.